I'm Dr. Hossein Azartash Namin. I am Doctor of Chiropractic. I have undergraduate background in microbiology, chemistry, human biology, then pharmacy, even the allopathic medicine. But mainly this past 15, 16, 20 years of my education has been on chiropractic medicine. My practice is in Oklahoma City metro area, in a city called Midwest City. The type of patients come to me are they are suffering from pain. Pain is whether chronic, they've had for a long period of time, or just acute form of pain that caused by injuries, such as sport injuries, such as auto accident, fall, variety of those. So when they have those pains, if it is not life-threatening, then they should come to me. If it's life-threatening, they should go emergency rooms or MDs or DOs that they're better equipped for those. We want to know what type of problem they are dealing with. If fits in our scope, such as pain management, injuries and all that they have. So we tell them that we make appointment, then they come in, then they fill out questionnaire sheets, then we take case history, then patient history, then we do conduct exam. Then once exams all done, our finding based on our exams, then we order x-ray for them. Then x-ray pinpoints, that's two things for me. One, pinpoints my diagnosis. Second thing is that tells me what I should do to patient, what I shouldn't do for their safety. I do require x-ray because without x-ray, I'm almost like, even though I can diagnose, but be a little bit blindfold. There are some blind spots over there. I want to make sure that that x-ray shines light on those, pinpoints it. If I suggest if my family wants to go to someone other than me, of course, then I make sure that they x-ray. Because without x-ray is a little difficult and mistake can be made. Misdiagnosis can happen. If any of them think that they won't, I think they are mistaken. Sure. Once I examine them, and based on their history that I read, I ask them question, what exactly their problem are, and how it happened, and the time, the condition that it has happened, and their symptoms, and all those gives me the pieces for diagnosis that I'm going to have. Then finalized by my diagnosis, finalized by looking at their x-ray. Then it gives me idea that approximately how long we're going to be dealing with this case. Then I can give them somewhat more clear idea that it may take few months, may take few weeks. Then they can make up their minds. Plus what I'm going to be doing, what we are going to expect from my treatment. Medications, I want to know those because many of them have side effects. Side effects can interfere with my diagnosis because some side effects can create some pain, some discomfort. And I see all ages, children as pediatric work, and teenage and young adults, and all the way to I've had patient 9 years old. Yeah, as age passes higher, goes higher and higher, makes it a little more difficult to correct many of the damages that have been done. But as earlier we catch them much better, and young people, children or teenage years come, I see some curvature on their spine, then I recommend the treatment to prevent to become that curvature goes further, becomes scoliosis. If you don't catch it by age of 40, 50, 60, then now we have scoliosis that calcified, and I don't think anyone can correct those anymore.